Thank you for caring and for always keeping us protected.
Going forward, I think vaccination is a very important tool for us, and even multiple vaccinations or updates to vaccines may be required. We try our best to convince patients to have their vaccinations, to see doctors when they are sick.
We always talk about the medical professionals in the hospitals fighting with COVID-19. But have you ever wondered about the doctors and nurses in HDB clinics? Today, I'll be visiting a HDB clinic in the heartland of Singapore, and I'll be interviewing a doctor on the trials and tribulations of COVID-19. I'm looking for Dr. Ong. Hi Dr. Ong, nice to meet you. I'm Emily. So do you think you can talk me through the procedures you take when a patient walks in?
Let's go to the front of the clinic. Before a patient comes in, they have to sign in at 2 points. One is the safe entry, which is something they do for all businesses. And the other one is a health declaration. We do it so that we can better stratify or triage patients according to their symptoms. So that's my staff, Lyra. She's dressed in the PPE. This is to help protect them, because before the patient sees a doctor, we do not know whether they are infectious or not. So we have special measures in place.
Do you have to make any changes to the clinic for safe distancing measures?
We have to try to ensure that, let's say the reporting sick crowd comes in at 8 to 10, and the elderly, they come in at maybe 10:30 to 12 o'clock. And in between, when there's a change, in the type of patients, we have to do a area cleaning as well.
Were there any other bizarre cases where like a patient was reluctant to do something or just their behavior?
I do have a few cases where after consultation, I inform them that they have to do a PCR swab. I tell them that they have to have this number of days of MC. So some of them may not be so understanding. They refuse the swab, they may walk out in anger, or they may try to bargain with me.
Family members, were they worried for you?
In my line of work, I may bring home the infection. So during the first the circuit breaker, when we were not allowed to visit them, that was a relief as well. But of course, you still have to worry about how they are getting on, their medical conditions and so on. And as for the second worry is my kids. They are young. At the time, we still don't know the effects of COVID-19 on children's body.
I understand that you were part of the swab isolation center. So how was that experience like for you, and was it any different from your clinic experience?
During the height of the pandemic, there was swab isolation facility. Changi Village Hotel is one of them. And they will see about 100 patients or 200 patients per day. Then we have to make sure that their medical conditions are stable, because some of them actually do have COVID. Once we identify that they are not stable, then we will transfer them to NCID.
So just to sum it up, how do you feel about this whole pandemic?
We know that it's very infectious. We are glad that it's not as deadly as the SARS. But it seems like it's a very drawn-out affair. So going forward, I think vaccination is a very important tool for us. And even multiple vaccinations or updates to vaccines may be required. We try our best to convince patients, to have their vaccinations, to see doctors when they are sick. So there's definitely a different mindset and approach to how we treat patients as well.
How do you feel towards COVID-19?
I do have a kid at home, so every time once I reach home, I can't really give her a hug, or I can't really talk to my mom in very close distance. The first thing I need to do is to change and get showered.
Are there any cases where in public people think that, oh, actually you're infectious, don't come near to me?
At the start, it's very hard for me to get Grab to work. It's very hard for me to actually take bus because like people will like stand distant away from us lah, and they will actually give you a look.
The PPE is actually uncomfortable and all that. So do you mind if I can try it? It's actually quite a lot of hassle to put it on and take it off.
So of course initially there were concerns about supplies. There may still be. So we try to make sure that we do so logically, and make sure that we don't waste our resources.
I feel like I've gained a whole different perspective into their lives and their jobs, as well as the sacrifices and discriminations that they face in this time of COVID-19. And I feel like the best is yet to come.